Hi, my name is PA Clarke. I am a facial aesthetic specialist and pioneer in facial rejuvenation using the best products and the latest techniques to keep my patients happy. We will be talking about facial beauty and what is possible with non-surgical facial rejuvenation. At Works Med Spa, we deliver amazingly natural, life-changing results. We help you consider what's possible and work with anyone wanting to reverse the visual signs of aging. But best of all, our results last. Have you ever gone out for lunch and wish you could return looking 5 years younger? What if I told you we could do that? What if I told you that is possible? Here's the thing, injectables should not necessarily leave you battered and bruised and swollen and red. It depends on the technique. So let me share a quick story. I had one patient off on her lunch break, ran in to see me. She had about 15-20 minutes and she wanted to just look different for the weekend. And this was about 2 days later that she wanted to look great. And just a few points using fillers, she left the office looking amazing. No bumps, no bruises, no swelling, no marks, nothing at all. This is possible. These are the 3 things you can do to look better in 15 minutes. Lips, nose, jawline. All right, let's start with the nose. So we have a beautiful patient, just had her nose done, and you can clearly see the difference. We've corrected that downturn tip back up. Now, she didn't want a curve, and she didn't want it too Romanesque, which is a very straight nose. Beautiful results, less than 15 minutes. What product was used? I love to use Restylane Lift for the nose itself, sometimes Restylane Regular. But this is what I mean, in 15 minutes, you can have a new, sharper, beautiful nose. It really boils down to the technique and the product being used. Some products gives you much more curvature. Some products give you much more angles, lengthening. And those are the products that you need for those quick turnaround lunchtime results. 15 minutes, nose is done. Next will be the lips. So with the lips, you can see that sometimes there's always a little bit of swelling. And these are our patients. Sometimes a little bit of swelling, but you can see from the upper lip and the lower lip, even though they're sweating, they look amazing. This is what you're coming for. You're not coming for redness and bleeding and bruising. That should not be on the menu. The menu is wonderful lips when you leave. That is what you should have. Now, many times we may assume that, well, my doctor, my nurse, my PA did a treatment and she told me that bruising is natural and bruising is normal. I actually had one practitioner tell me that if your patients leave the office bruised, that's just a normal part of the treatment. And I have to say categorically no. You should not leave your office battered, bruised, and swollen. Let's look at the third, which is the jawline. I love a jawline. Jawlines can make you look very distinguished for the gentlemen, and for the women, jawline can really pull in a uniform definition within the facial silhouette. So sometimes you have more of a curvature of the face. This occurs more commonly as we're getting older. We lose the bone, the muscles get softer, the ligaments get longer. And what happens? The natural curvature of the jawline tends to go away. So the jawline gets a lot softer. Using Restylane, I can actually pull the edges out and give a much firmer, a much straighter, a nice edgy jawline. And these results can last for a very, very long time. Again, this is an example of a wonderful jawline without the curves. Now, not everyone wants a sharp jawline. If you do, then this is possible with Restylane. Now, if you want more of a curvature, Juvederm is your guide. Juvederm will do that for you. However, depending on what you're looking for, make sure your injector knows the difference. What makes us special at Diamond Works? Well, it's going to be the approach. When you step into our office, my first question is, what are you looking for? What are the areas that trouble you? After that, we're going to go into the assessment. I'm going to make sure that you're going to have exactly what you're asking for as long as we're on the same page, which is why I need to see pictures or I need to hear in depth what is it you're looking for. And whether it's the nose or the lips or the jawline, I have to make sure that when you leave, you're not bruised, you're not swollen. So let's look at that approach again. Typically, the assessment comes first, and then there's the technique. Once you decide on the product you want to have done, it's the technique. Technique makes the difference. Technique takes years to develop because it's the same thing over and over. I make this analogy with being a great chef. You have to do the same ingredients, the same temperature setting of the pots and pans. You have to do the same thing over and over and over. And this is why when you come to have your injectables done, your injector have to have many years of injecting to understand that these results don't just come because I'm popping a needle on you, but these results come from the technique. That's the diamond touch technique that we typically use. That is your 15-minute treatment taking 5 years off. You will look stunning, you will look beautiful, you will leave my office looking better than you came, and you will get back after your lunch break looking 5 years younger. Thank you for being here. Post your questions and comments below. Don't forget to follow us on social media. Up next, rapid quick fire, where I get to answer all of your burning questions.